Hello, my name is Lyle. I'm a physician that worked for the Indian Health Service in 1977 up to 1998. And then in 1999 I began work with the Strong Heart Study, which many of you may have heard of and some of you may have actually participated in. In 1988, a group of scientists and investigators approached about 4,500 American Indian men and women over the age of 45 in 3 different locations. One center down in Arizona, center in Oklahoma, and then up here in the Dakotas. And they invited these people to participate in a study of heart disease and risk factors for heart disease. And if they agreed and consented, then these individuals were asked a series of questions having to do with their lifestyle, their diet, exercise, whether or not they smoked, and so on. A number of examinations were done, including EKG, blood pressure measurements, and so on. Blood samples were taken, urine tests were done, and so forth. But most importantly, these individuals were asked if they would give permission to allow the researchers access to their medical records on a regular basis, usually every year. The reason for all this is if we can see there's a particular factor that is occurring in this particular time period, and then years later, even though that wasn't present at the time, the individual developed a condition like a heart attack or a stroke or perhaps damage to the kidneys or problems with circulation in their legs, then we can be fairly sure that this factor came before this outcome or this condition, this disease occurred. And that's the most accurate way we have from an epidemiologic standpoint to be sure of our findings. In addition to just measuring these things, we also gave information back to the participants. So if their blood pressure was elevated or if their cholesterol was higher than it should be, we gave them information about that and encouraged them to see their physicians and have these things taken care of. Now you might be saying at this point, well, don't we already know that high blood pressure, for example, like smoking and so on, causes heart disease? And I think to answer that, we need to go back really to the late 1950s, and it's rather surprising and disappointing to realize how little the medical profession really understood about this whole process of hardening the arteries that occurs generally as we age and goes on to produce heart attacks and strokes and so on. For that reason, they set up a study in a town called Framingham, Massachusetts, and they did a very similar thing in Framingham. By the very early in the mid-60s already, it was quite clear that there were certain things that definitely predicted heart disease in the future, and one of those was blood pressure. But at that time, the medical profession, actually, their term for high blood pressure was essential hypertension. And the reason they called it essential is because they thought it was necessary for the body to compensate for the aging process. So as we get older, our arteries become harder, there's more obstructions and clogging and so forth. And it was necessary, it was essential to have a higher blood pressure in order to force the blood through those obstructions. And that was the theory at that time. Today, because of the Framingham Study and others, we know that's completely backwards, that the reason that you have high blood pressure is not because your arteries have become clogged. Your arteries are becoming clogged because your blood pressure has been too high. It's just the other way around. And so that's one of the important things about a study such as this, where you're following people over a long period of time. You can be certain that the factor you're worried about comes much before the outcome or the disease you're looking at. So again, you might say, why was it necessary to repeat these kinds of studies in Indian country? And I think first we need to go back and look a little bit at what Framingham, Massachusetts is like. So this is a town of about 30 or 40,000 people, and it was relatively well off at that time. It was primarily European in background. Most of the participants were male. There were very few minorities in the community. So people began to ask, well, what we found there is very interesting and useful, but does that really apply in Indian communities? Are quite different. Besides just the ethnicity, the socioeconomic conditions in Pine Ridge and Eagle Butte are very different than what they are in Framingham, and so that's one of the reasons that the Strong Heart Study was developed. Even physicians who cared for Indian people back in the 50s and 60s were not at all convinced that heart disease was a serious problem. And there were reports from the Southwest in particular that in a large facility there that cared for lots of Indian people, they had never seen a heart attack in many years. And I think this was because it was just at the very beginning of the epidemic of heart disease that was developing in Indian communities and in the Southwest, where there's a relatively small amount of smoking compared to other regions. So it wasn't very long after the Strong Heart Study began. Within a few years, it was very clear that heart disease is an important factor in the health of American Indian communities, and a very serious factor, and that it was driven to a large extent by diabetes. Now, a little bit later, in about the mid-90s, we were able to say that the main risk factors for heart disease in the non-Indian population, such as high blood pressure, smoking, cholesterol, and others, are operating in pretty much the same way in Indian people as they do in non-Indian people. As I was taking care of patients in the clinic in our facility, many people would come to me, especially in diabetic clinic, and they would say, well, yes, doctor, I know my blood sugar is 220 this morning, but Indian people have a different metabolism, you know, and that's really normal for us. And after the Strong Heart Study results were in, I could see quite clearly, no, that's not normal. No matter what you think about your metabolism, your risk of heart disease and other complications goes up pretty much the same with diabetes, whether you're Indian or non-Indian. Likewise, some people would discount the effect of tobacco. They'd say, well, tobacco is sacred for us. We've been using it in our ceremonies for many, many years. How could that be harmful? And again, I have no concerns about the traditional use of tobacco in ceremonies, but knowing that from what we know from the Strong Heart Study, smoking a pack a day of Marlboros is just as bad for you, whether you're Indian or not. Now, there's many, many other findings that came from the Strong Heart Study that are more detailed and are used more for physicians and perhaps a little less for public health officials. But these are a couple of the main ones that I think have been developed. Now, I know you've heard it many, many times before, but the main ways that you can protect yourself and maintain good health is to, first of all, control your weight so you don't develop obesity. Eat a good diet with plenty of vegetables and fruits. Listen to your doctor when he or she has concerns about your blood sugar, your blood cholesterol, your blood pressure, and so on. And be sure to exercise regularly. Lastly, I'd like to thank those of you who've been involved with Strong Heart, starting with tribal leaders who had the foresight to see that this was an important problem that needed further study to develop prevention methods and so on. To all the participants who cooperated generously year after year, phase after phase from 1988 forward through 6 phases, and continued to assist in this way. American Indian people can be truly proud of the contributions they've made, not only to tackling this problem in their own communities, but to help better understand heart disease and how to prevent it around the world. And for that, I thank you.